The diagnosis of ADHD and treatment with prescription medications has really increased substantially in the past couple of decades.
And now a University of Michigan study finds the increased access to these medications is having a carryover effect into abuse trends. Dr. Frank McGeorge is here to explain what researchers discovered, Doc.
Yeah, well, the information actually comes from the Monitoring the Future study. That's an annual survey of 8th, 10th, and 12th grade students that's published in JAMA. Now, overall, they found 1 in 4 middle and high school students may be abusing ADHD medications. Specifically, they found that while some schools had little to no misuse of ADHD medications, in other schools, more than 25% of students had used stimulants in non-medical ways. Now, students attending schools with the highest rate of kids that were actively being treated for ADHD, they had a 36% increased chance of non-medical stimulant use. Now, these medications can be abused to get high or combined with alcohol or other drugs to boost the high. Also, keep in mind, in some environments, these stimulants are being abused to actually enhance academic performance. Now, suburban schools in all parts of the U.S., except the Northeast, had higher rates of teen misuse of ADHD medications, and also schools with more white students and those who had medium levels of binge drinking were also more likely to see stimulant abuse.
Interesting. So besides being at a school where more kids were on ADHD medications, were there any other things that predicted a higher level of abuse of these drugs?
Well, not surprisingly, you might imagine that if students used marijuana in the past 30 days, they were 4 times more likely to abuse stimulants compared to teens who didn't use marijuana. So here's the big picture. Regardless of the reason that your child might have that higher risk, knowing those risks really only helps if parents intervene. So don't assume that your child is immune. You just have to have the conversations and ultimately set the expectations with them. Don't ignore the red flags.
Communicate. All right.